What inspired me to become a physical therapist is because I grew up just injured all the time. I played competitive tennis, and I played tennis for UC San Diego. I was injured everywhere. I had tennis elbow, and I had golfer's elbow, and I had wrist injuries, hip injuries, ankle injuries. Oh goodness, if I could list it all to you. So it was my own experience with the physical therapist and athletic trainers that completely shifted my mind to the power of rehab and how it can help you reach your goals. So that was just so huge to me, experiencing it myself. And I wanted to give back to others and do the same thing, helping them reach their goals and their dreams. I think what keeps me focused and motivated, that's a really good question. I feel like when I think about the people around me, I'm a huge people person. I have a lot of friends and a big family, and when I'm around them, I continue to see their lives and how movement's so important and how everyone's injured right now. So seeing how their lives are and hearing how they're deeply impacted by when they're injured and when something isn't going right, I remember that, and I guess it helps me have empathy. So it just motivates me, just remembering it's kind of cliche, but remembering the pain that people are feeling. It really helps me remember the bigger picture of why I'm doing this. It's to help people live the best life that they can, because pain and dysfunction and not being able to do things like pick up your grandkid or being able to drive somewhere to go to work, it's a really big deal. So that's one of the many things that motivates me. What I teach my students, and I think this is so important, especially since they didn't have much experience with patients before they went to school. So I always drill in their mind to remember that each person is different, and each person, they need a unique treatment because not everyone's the same. And I find that so important because I think the students get caught up in their heads and they focus so much on textbooks and remembering protocols and remembering numbers, but for them to remember that every person is unique and you have to cater your plan to them. That's the key to good physical therapy and for really caring for people. So I'm really passionate about this question, and I feel it's really important to always update and to change your profession to what is the best at the time. And I kind of see this trend right now where physical therapy is getting a little bit more exercise only focused, and physical therapists aren't touching their patients anymore. I think it's a big part of physical therapy is our skills of what we can do touching the patient. So I do feel that trend of just only exercise and not doing any manual therapy, that's something that I wish I could change, because I think it's really important to always do manual therapy and it sounds weird to touch the patient and to touch the patient. What drove me to be part of this team? Easy. So I've been a patient here actually for a while. I came here I think in 2021, I think. 2019. So a long time ago, I was in a car accident and I was looking for a chiropractor. So I came here then, I loved the team, graduated, left. And then recently I got pregnant, and as you can see, I'm no longer pregnant. I had my baby. So I came here to see Kelly for prenatal chiropractor. And I would just see the team every time I walked in, and being a physical therapist myself, I could see when it was good quality care. And also I just saw how everyone was, and they're just so nice and compassionate. I could tell that they genuinely love all of their patients. So yeah, it was really easy for me to want to work here, and I wasn't looking for a job until I was looking for a job, and then I realized I want to apply at HealthFit. So yeah, that's a very easy reason why I'm here, and I'm so happy to be here.